Hello, this is Professor C.P. Prakasham, former professor from International Institute for Population Sciences, Mumbai. I will be discussing about measurement of diseases, concepts of epidemiological study. Epidemiological studies deals with growth and distribution of the diseases according to the place, time and person. Epidemiological studies divide into descriptive, analytical. The analytical epidemiological studies deals with the likelihood of development of the disease in the exposed group relative to the non-exposed group. Studies are divided into two parts, broadly into two categories. One is the case control study and another is a cohort study. And it is also called observational and experimental studies. The observational studies are case control studies, case crossover studies. Experimental studies are the cohort studies and cross-sectional studies and ecological studies. That we will discuss little later. Then, what is a case control study? Case control studies are used to determine the degree of association. The factors that affects the risk of the disease is called exposure between various risk factors and outcomes. That means it deals with the identifies the exposure, from that it identifies the risk factor and calculates the association between that. What is a case? Case is the patients or a sample element who are exposed for particular disease or any other intervention. Controls are those the patients that do not have the disease or sample element that is not exposed for the intervention. Not exposed for the advantages and disadvantages or limitations of the case control studies. Case control studies are inexpensive because it works with a small sample, and more efficient because it is under the supervision of the qualified persons or the researcher, and also it is a less time consuming. These studies is designed specially suitable for rare diseases such as you can say cancer or otherwise heart diseases and all the cardiovascular diseases or anything. The case control studies also can be applied in the large data in the field studies also. Case control studies begins with a conceptually with the disease and the conditions we are looking for. That is, it is a backward exposure. Excluding the controls by symptoms alone might not guarantee that they do not have the mild cases or illness under the investigation. This is one of the limitations of the case. Then here is the example, case control study. If you look at this example, if we have to identify in the case control study, we have to identify the cases. That if you assume that case is the cancer A and non-cancer B, then we will identify from the cancer patients or non-cancer patients whether they are smoking or not. Similarly, from that we will be getting the unexposed for the smoking, and we will have A, B, C, D in a dichotomous table. Then we have to find out what is the odds which are contributed for the cancer disease and by the exposing to the smoking. That is calculated by using the odds ratio. Odds of exposure in cases divided by the odds of exposure in control. Here it is control or otherwise here it is given. Therefore, A divided by C divided by B divided by D, that will give you AD by BC. Then when you look at this right side picture, they will identify the cause, that the cancer or non-cancer. From that patients they will identify whether they are smoking or non-smoking, and then calculate the odds ratio, that what is the contribution of exposure in relation with the non-exposure. Here we will illustrate with an example. A case with disease is 40. This is the illustration is given, and case without the diseases are 20. Among that means among the 60 patients who have identified, and we assume that they are having the history of exposure to the smoking. Similarly, we will take the 70 people, and then from them the exposure to the non-smoking is given here. These things are 40 plus 20, 10 plus 17. These are the total sample. From these cases, we are identifying the smoking. Then we find out what is the odds ratio. The odds that is a case was exposed divided by the odds that is control was exposed for that. That is AD by BC equals to 40 multiplied by 60 divided by 20 multiplied by 10. That will give you 12. What is the conclusion? The odds of developing a disease among the smokers, odds of developing a disease. Then another one is the case crossover studies. In the case crossover studies, it will help you to study a change of the disease in the individual. This is done for the studying the transit exposure or the risk factor over a period over the individuals. In this study design, we will require case and control component of the same individual. A person is taken, and if you look at this down below table, a case is there and control is there. First of all, we will take the cases, and then we will identify individual and keep them for the exposed for the disease, such as if you select a diabetic patient and give him a glucose, and then afterwards sometimes you allow him to absorb the sugar in the blood, and there is a washout period, that is a 1 hour, 2 hours, 3 hours, like that, and again you study the same person in the next time period and then find the differences. Therefore, each case is self-matched by serving its own control. This is most important. Determining the control and case component period is a critical and difficult aspect for the case crossover studies, because how much is to be exposed for a case and how much to be controlled for the washout period and again taken into control as this one is a question that depends upon the research. Then cohort studies, another one is the cohort studies. Cohort studies begins with a group of person without the disease or without intervention under the study, but with the different exposures of experience, and follow them over a period of time and find out how many people are there at the end of the time period, and then find out the difference between the initial and final period with the intervention or without intervention. That is also known the occurrence of the disease among the person with the different exposures is compared to assess whether the exposures are associated with the increased risk of disease. Cohort studies can be a prospective or retrospective study. What is a prospective study? A prospective cohort study is to enroll a person initially and follow them over a period of time to observe the changes in the disease pattern. Following over a period of time is most important thing, and here the enrollment of the patients at the same time and allowing them to expose for the disease condition and how much duration to be followed up is to be judged by the researcher. The unexposed or the lowest exposed group serves as a comparison group and provide an estimation of the baseline and expected amount of the disease. This can be compared with the persons who are in the same cohort who are not exposed for a particular disease pattern, follow them in the same way as the case and then study them over a period of time and make the comparison between the beginning and the end of the time period. That will give the process. Then retrospective group. In this retrospective group, the cohorts are enrolled a different participation group after the disease or the condition of the interest occurred. Suppose that means you are selecting the patients, cancer patient initially, and ask them whether they are having the smoking habits, how much duration they are having the smoking habits, like that you can ask. That is, backward information will be collected from the cases. After eliciting exposure history and compare the diseases, the incidence among the persons with the different exposure will be calculated. Then we have to identify what are the measurements to be used for the cohort study. Prospective and retrospective cohort studies are. Then these are the measurements of the cohort study. Cohort studies are prospective studies where the risk is estimated directly. One is the relative risk and another is the attributable risk and attributable risk percentages. These three will be given some idea about the cohort studies. Straight with an example. Cohort studies data measurement. The occurrence of the uterine cancer and exposure to the contraceptive. The idea is that those who are exposed for the contraception may have, likely to have a uterine cancer. And in this exposure, we will identify the persons who are using the contraception and also who are not exposed to the contraception initially. Then we will follow them over a period, we will follow them and then find out the occurrence of the uterine cancer. Therefore, here you are selecting the cause and identifying the cases. Among these persons who are having cause and not having cause. Therefore, if you look at this 2 by 2 contingency table, you will find out the exposure to the contraception. From this given data, we can calculate the risk ratio. That is, risk ratio is equal to incidence in exposed divided by the incident in the unexposed. That means we are taking exposure for the contraception and identifying the occurrence of the disease. Then incident of the exposure for the contraception and occurrence of the disease is given by A plus B divided by incident of in the unexposed, that is C by C plus D will give us. Let's example now. Measurement of the cohort study. A researcher aims to find out the impact of smoking on children of less than 12 years in a smoker's family. He identified 500 children who are exposed for the family of smokers. Identified that another 500 children who are non-exposed to the family of non-smokers. That means he is finding out the effect and through the cause which is causing the respiratory diseases. Following is the followed them for the 1 year period. At the end of the year, he has been observed the following data, that the family of 500, among that 300 children are exposed for the respiratory diseases, is exposed for the family of the smokers, and effect is the cases are the 300 respiratory diseases and 200 the non-exposed, non-respiratory diseases. Similarly, family of non-smokers 500, 120 are the cases with respiratory, 380 are the no respiratory diseases observed at the end of the 1 year period. With the example given, we can calculate the incident rate as well as the relative risk for the cohort study. The incident rate, here it is given that A by A plus B, that is 300 divided by 500 multiplied by the percentages 100 will give you the 60%. Similarly, incident rate among children belongs to the non-smoker family, that is C by C plus D, that is 120 divided by 500 multiplied by 100 will give you the 24%. Then the relative risk is measured as incident rate among the children who are exposed divided by the incident rate in the non-exposed. That is A by A plus B divided by C by C plus D. That is 60 by 24, that will give 2. Then the conclusion is that children less than 12 years in a family smokers were 2.5 times at risk of developing respiratory infection when compared to the children of family of non-smokers. That means the smokers family children are 2.5 times higher at risk than the non-smoker family of the children. Then we will see that what is the interpretation of relative risk and in the cohort study. If the calculated relative risk is equals to 1, then risk in exposed is equal to risk in non-exposed. That means there is no association between that. There is no association between effect and the cause. If the incident rate is greater than 1, the risk is in exposed is greater than the risk in non-exposed. That is a positive association. And if your RR, that is risk ratio, is less than 1, risk in exposed less than non-exposed, negative association. This will further, if you look back the cohort studies and case control studies, we cannot derive the incident rate in case control study. That is important. Here is the further calculation of the measurement of the cohort study for the same data. Another one is attributable risk, the amount of disease that can be attributed to the exposure. The attributable risk explains the excess risk of disease in those who are exposed compared to those who are non-exposed. Here in our example is exposure for the smoking and the disease is respiratory disease. Therefore, attributable risk AR equals to incident rate in exposed group minus incident rate in the non-exposed group. Earlier we have calculated the incident rate of exposed group is 60% and incident rate of non-exposed group is 24%. That difference will give you 36%. The conclusion is that 36% of respiratory infection among children can be attributed to the family of smokers. Similarly, attributable risk percentages, that means this will give, if it is taken in the general population, what would be the risk estimation. That is attributable risk of the percentage. That is equals to AR percentage equals to incident rate among the exposed minus incident rate of non-exposed divided by incident rate among exposed. That is the ratio we are calculating. Then the difference will give you, the calculated value will give the end result as 60%. That is called population attributable risk. It can be concluded that the risk of getting respiratory among children 60% higher in those exposed family to the smokers when compared to those who are non-exposed family children in the population, that is in the universe. That will give the general picture of that. From this we can compare with the other population data. Further, let us come back to the cross-sectional study and the longitudinal study. Cross-sectional study measures the prevalence of health outcome, or it determines what are the social determinants influencing the health condition, or both in a population at a point of time or over a period, in a short period. That is the cross-sectional. The longitudinal study is subjected to the followed over a period of time with a continuous or repeated for a monitoring of a risk factor or a health outcome. One of the example you can see that longitudinal aging study of India. Of some other studies are there. Most of the longitudinal studies examines association between exposure to the known or suspected cause of disease and subsequent morbidity or mortality. All statistical measures applied for analysis will give you the trend analysis only. Then this will give you the diagrammatic picture, that is the flow chart of a longitudinal study, how it will look. Initially we will identify the households, and then we will recruit the women who are exposed for the violence, and then divide into two groups. One is the experimental group and another control group, and then conduct the focus group discussion, and then intervention will be followed and the end results will be measured. This will be taken a 3 years period. In the 3 years period, before and after study, with the intervention during that period will be assessed. There will be initial evaluation, mid-term evaluation and end-term evaluation will be taken into consideration. During this period, there may be last follow-up, or there may be a migration of the new sample into the study area, or there may be migration to the outside from the study area. That has to be taken into consideration. Then ecological studies. Most epidemiological studies investigations are observational. Cause and effect relation exist to establish association between the occurrence of the disease and known cause. In ecological studies, it is different. The unit of observation is the population or a community, the large data. Disease rate and exposures are measured in each set of population and their relation is examined. Therefore, ecological studies is mostly based on the large study, and epidemiological studies may be restricted to clinical as well as the large community studies. Thank you very much, and please like it, share it, and then subscribe it.